Good afternoon, everyone. My name is Elizabeth Jennings. I'm the Director of Training and Technical Assistance for National Disability Institute, and it's my pleasure today to welcome you to our Financial Wellness webinar, The New Healthcare Changes in You. Typically, we try to wait a few minutes as we have had a lot more people register than have joined so far, but we have so much to share with you today that we don't want to waste even a moment to make sure that you have enough time after our presenter today to answer any questions that you may have and to make sure you have all of the information that you need. Before we get started, I'm going to invite my colleague, Nakia Matthews, to offer a few housekeeping tips.
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see here. And if you accidentally close this panel or the sound stops or becomes unintelligible, you can reopen it from the top menu by going to Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number and meeting code that you see here. Please note that you do not need to enter an attendee ID. And I will also post this information into the chat box for anyone who needs it later. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of your webinar platform. If you'd like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A. And conversely, if you do not need the Media Viewer, if you do not need the captions, you can minimize that panel. We will have question and answers throughout the webinar today. We'll have them at a few different points. You can send any questions that you may have during the course of the webinar to myself, Nakia Matthews, or Elizabeth Jennings, and we will direct those questions to our speaker accordingly. If you are listening by phone and not logged into the web portion, you may also ask questions by emailing Elizabeth directly at ejennings@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the NDI website at realeconomicimpact.org/financial wellness. If you experience any technical difficulties during the webinar today, please use the chat box to send me, Nakia Matthews, a message, or you may also email me at nmatthews@ndi-inc.org.
Thank you so much, Nakia. So today we're going to provide for you an overview of financial wellness and why we discuss this in regards to individuals with MS. We're going to introduce Tanya Schwartz, who's with us today to provide you an overview of the new healthcare changes in you. She'll be sharing with you what the new healthcare changes mean for individuals with disabilities, when the changes take effect, the overall impact of the new healthcare legislation, and she's put together several quality resources for you. We're also going to offer some time to do questions and answers with Tanya, and if we don't have enough time today to answer your questions, please don't be concerned. You can send them in and we'll send you answers after the webinar. I want to start by offering a special thank you to our sponsor, Accorda Therapeutics. For the past few years, Accorda Therapeutics has provided funding to National Disability Institute to provide the MS Financial Wellness webinar series, and we're very grateful to them for their support. For those of you who haven't been with us before, National Disability Institute is a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities. We are a group with a sole mission to build a better economic future for Americans with disabilities. When we talk about financial wellness, we're talking about a state of a person's finances with the intent of working towards financial behaviors that limit stress and the impact of stress on one's daily life. Financial wellness can have many components. It can be increasing your financial literacy, accessing affordable financial services, utilizing favorable tax provisions, which we will talk about next month in December's webinar. Financial wellness can include budgeting, understanding your public benefit rules to empower you to earn more or to save more, building and maintaining assets, accessing available healthcare subsidies, and understanding work and your long-term disability options. If you haven't had a chance to tune in to other webinars in this series, I hope you will as we cover each of these components in our attempt to help you as you seek to build your own personal financial wellness. We're very interested at National Disability Institute in the intersect of disability and poverty because the poverty estimates for people with disabilities are twice the rate of those without. In 2011, individuals without disabilities lived below the poverty level at a rate of 12.4%, and individuals with disabilities lived below the poverty level at a rate 2 times that, 27.8%. We know that despite the many opportunities that exist, there is no group in America that is in more need or more deserving of economic recovery than those living with disabilities. For millions of working-age adults with disabilities, a dependence on public benefits for critically needed income, health care, food, and/or housing often becomes a trap that requires staying poor to stay eligible. And part of what we seek to do is encourage individuals to have quality information to fully understand their options and to make informed choices about their public benefits. Much of our work is derived from the Americans with Disabilities Act. The Act says that the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. And that's the piece that we really focus on, the economic self-sufficiency. Our goal is that this webinar series will support each individual's right to have that equal opportunity to be economically self-sufficient. Why is that important to us and to many of you on the line? It's because financial wellness can have an impact on your mental and physical health. The level of stress that our finances causes can create great havoc with our physical health. It also positively impacts your self-concept, changes your status with other community members, directly impacts your quality of life. And for many of us who need things like prescription drugs, accessible transportation, having the income available to afford those things can make an incredible difference in our ability to participate in community life. Before we started this webinar series back in 2011, we completed a survey with our partners at the MS Association of America, and we learned a great deal that we use to construct the webinars each year. We learned that more than half, 55.1% of households surveyed, earned less than $35,000 annually, and 16.4% earned less than $50,000 but more than $35,000. When asked about the ability to pay all of their bills in a typical month, 32% reported they had a very difficult time paying their bills, and almost half, 46.9%, reported a somewhat difficult time. Also, 43% of respondents reported that their financial status has affected their ability to access medical care at some point in time. We further learned that 71.7% of people who responded to the survey do not have enough savings to cover 3 months' expenses. That's a key indicator that a person's financial wellness is off. 67.1% of respondents reported that their finances were worse since their MS diagnosis, and almost 2/3, 73.7%, reported that they were not aware of or had not used several financial stability programs that we talk about through this series, including the Earned Income Tax Credit, individual development accounts, family self-sufficiency programs, and Social Security's Plan for Achieving Self-Support. There are many financial wellness strategies that exist and that we talk about throughout this webinar series. Again, if you haven't had a chance to learn about one or more of these opportunities, I hope you'll visit the archives, which we'll post a link to in the chat box so that you can have that link available to you. We talk about many of them, and we have other supports and services to offer if you're interested in more information. But the strategies can include all of the different components that you have on your screen here. Today, we really want to focus on your access to healthcare and how your healthcare can impact your opportunity to improve your financial wellness. So I'm thrilled to present to you today Tanya Schwartz. She's a manager at Manette Health Solutions. Ms. Schwartz is an interdisciplinary policy and business advisory with the, she's a manager with Manette Health Solutions, an interdisciplinary policy and business advisory division of Manette, Phelps & Phillips, LLP. She provides strategic business and regulatory advice, policy analysis, and project oversight to public and private clients on issues relating to federal health care reform, public health insurance programs, including Medicare, Medicaid, and the Children's Health Insurance Program, or CHIP. Prior to joining Manette, Ms. Schwartz served in various roles at the Centers for Medicare and Medicaid Services. She worked as a policy advisor to the Director of Medicaid and CHIP, Technical Director for Initiative to provide support and assistance to states on Medicaid and CHIP changes under the Affordable Care Act, and managed the Medicaid Eligibility final regulation that codified many Medicaid and CHIP provisions. Prior to working at CMS, Ms. Schwartz was a policy analyst with the Kaiser Commission on Medicaid and the Uninsured at the Henry J. Kaiser Family Foundation. You can learn more about Ms. Schwartz at the link provided. And I am just so grateful to her for participating with us today, and offer a warm welcome to Tanya Schwartz. Thank you for joining us.
Great. Thank you so much, Elizabeth, and good afternoon, everyone. I'm really happy to be here, and thank you for asking me to participate today. So I'm sure that many of you have been hearing lots of news reports about the implementation of the Affordable Care Act, which is also referred to as Obamacare and health reform and has many other names. So today we're going to talk about the health coverage options that may be available to you, to your family members, and to your friends. And so I hope this conversation today will give you a broad understanding of the health coverage options that are available and how they work. But it will be quite a bit of information. So at the end, we're going to take a step back and think about the practical information that people need to know when they apply for coverage, because while it's helpful to understand how all of these, kind of the rules and the eligibility around all of these options, in the end, if you do apply for coverage, you'll provide some information about you and your family, and the system will decide which program you're eligible for. And so at that point, we want to make sure that you know what questions you want to ask at that point, once you know what program you're eligible for, to make sure that you're getting a health plan that covers your needs as best as possible, both to make sure it covers the benefits you need and to make sure that there are financial protections so that you can afford coverage. So again, we will take a step back at the end and think really practically about steps that you can take to apply for coverage and what to do after you obtain coverage. So let's dive right in. So today I'm going to do just a broad overview of the Affordable Care Act and some of the coverage changes, and just give you a landscape of some broad provisions. We're then going to talk about some key private insurance market reforms that really get at new rules to prevent insurance companies from discriminating against individuals and to guarantee coverage for all Americans. We're then going to talk about the new Medicaid expansion, which expands Medicaid in certain states. Some states have decided not to expand Medicaid at that time, so we'll get into that. After we talk about Medicaid expansion, we will pause for some questions, and then we'll move into the new marketplaces, which I'm sure you've heard a little bit about with all the news around it, but we'll talk about the marketplaces and who's eligible for the marketplaces and financial assistance that people can get in the marketplaces. We'll then take another pause for questions there, just to try to break it up a little bit. And then, as I mentioned before, we'll end talking about just some practical information that is helpful for consumers when applying for coverage and selecting their plan. So the Affordable Care Act Act, as I'll refer to it today, was signed into law in March of 2010, and it makes major changes to how uninsured people and underinsured people secure coverage in the United States. So as we've done in today's presentation, there are kind of three main buckets of coverage changes. We have these new market insurance reforms, we have the expansion of Medicaid in certain states, we have the establishment of new marketplaces where individuals and small businesses can purchase private health insurance. And then we also have new, what we call insurance affordability programs, which provide financial assistance to help people be able to afford and purchase marketplace coverage. And so people can apply for all these different types of coverage using one single application, and we'll talk about that a little bit later. So when you apply, you don't need to know what you're applying for. You can apply and they'll figure out what you're eligible for. So the Affordable Care Act does make a number of other changes to the healthcare delivery system, establishes some new public health initiatives, and includes a range of other financing provisions. So we're not going to talk about those today. We're not going to get into Medicare and long-term care services because there's just so much to cover just on this topic alone. So we won't touch on those today. If people have questions on them and they can send them in, we'd be happy to try to get you some answers on those. But we won't be able to fit everything in today because there's so much to talk about. So this slide basically just explains how all of these different coverage programs fit together. So we have Medicaid at the top in states that are expanding Medicaid go up to 138% of the federal poverty level, which is a little bit over $15,000, an annual income of $15,000 a year for an individual, and a little bit over $31,000 a year for a family of four, and that's in states that expand Medicaid. We then have CHIP, the Children's Health Insurance Program, which is for children, and this eligibility level varies by state. We then have these new qualified health plans, which are the name of the plans that you can purchase in the marketplaces, and qualified health plans are available to people at all income levels, but people up to 400% of the poverty level, which is about $46,000 annual income a year, or about $94,000 annual income for a family of four. Those people are eligible, may be eligible to get financial assistance paying for this coverage. And then people over that income amount can purchase qualified health plans at full cost. And then, of course, we still have employer-sponsored coverage, and most Americans today, about 2/3, do get their coverage through their employer. So again, this just shows kind of how all the different coverage programs we're talking about today fit together. So it's estimated that millions of people are going to be able to get health coverage through these new Affordable Care Act coverage expansions. So you can see here that the number of uninsured is expected to be reduced from about 55 million to 31 million, so a reduction in the uninsured of 24 million people. We expect to see a little bit of an increase in Medicaid because of this Medicaid expansion. About 11 million more people are expected to get Medicaid coverage. And then the Congressional Budget Office projects that about 25 million people will enroll in these new marketplaces, and many of them will get financial assistance helping to pay for coverage. And then you can see there's also a slight increase in the number of people that are expected to get employer-based coverage. Okay, so now we're just going to dig into these private insurance market reforms under the Affordable Care Act. And these insurance market reforms apply to all health insurance plans, not just ones in Medicaid or these new marketplaces, but all plans. And they're really important reforms that help millions of Americans, especially people with pre-existing health conditions. So in the first bullet, insurance companies can no longer deny coverage to any individuals because of a pre-existing condition, including a disability. They also can't drop people from their coverage or refuse to renew their coverage because of pre-existing health conditions. So this is very, very important for so many of us who have pre-existing health conditions. So that's a huge, huge reform that was included in the Affordable Care Act. Insurance companies cannot charge more because of a person's health status or their gender, which is also very important. So the plan premiums can only vary by a few factors, that are listed here. We know that costs vary based on where you live. There's some variation that's allowed by age, but it's limited. If you're a smoker, there might be some additional premium cost that applies to you. And then we look at family size, which is basically, are you getting coverage just for yourself, or are you also getting it for your entire family? And then finally, the law bans insurance companies from imposing lifetime dollar limits on health benefits, as well as annual limits on benefits, which is just so important, especially for individuals with health conditions. So we don't have to worry as much about going without treatment because we have these limits that we have to stay under. Additionally, the plans have limited out-of-pocket costs, so there are caps on what you have to pay out-of-pocket in addition to the premiums. There is no cost sharing for preventive services, which is really important, I think, to many of us. Then the third bullet here, insurance companies cannot retroactively cancel your health insurance. So if you develop a health condition, they can't go back and cancel it also, which is also important. Another provision you may have heard about, because it gets quite a bit of attention, is that young adults may remain on their parents' plan until age 26, which has enabled a lot of young adults to remain on coverage and to not be uninsured. And finally, insurance companies must spend 80 to 85% of all of the premium dollars that are paid on actual health care services as opposed to administrative costs or marketing. And if your insurance company doesn't spend this share on services, then they actually have to send back some money as a rebate to the individuals who bought coverage through them. So some of you may be aware that there is a requirement to purchase health insurance. We're not going to spend a lot of time on this today because I presume many of us on this call want to get health insurance and want to have health insurance. But there is a requirement that people have health insurance that meets minimum standards, or they're required to pay a fee, which is called a shared responsibility payment. So if you do have this minimum essential coverage, then you will not be assessed a fee. And in addition, there are some people who are exempt from the requirement to have minimum health coverage or pay the fee, but it's just important to keep in mind that at the end of the year, people who do not have health insurance will have to make a payment. And again, this requirement is designed to support those private insurance market reforms that we just talked about to enable us to ban denying people coverage with pre-existing conditions. So this requirement really helps us keep those important private insurance market reforms. So now we're going to move to talk about the Medicaid expansion. So as many of you probably know, Medicaid is an existing federal state health insurance program for people with low incomes and for people with disabilities. And the Affordable Care Act expanded Medicaid to more low-income adults. So the expansion goes to 138% of the poverty level, which is, again, about $15,000 for an individual and $31,000 for a family of 4. However, states can decide, because of the Supreme Court decision that was made last June, states can decide whether or not to expand Medicaid. And so in states that do not expand, the eligibility levels for Medicaid that have been in existence are going to remain the same. But in the states that do expand, individuals who receive SSDI benefits, for example, and have a 2-year waiting period before they can get Medicare, can obtain coverage through this Medicaid expansion if they meet the financial eligibility requirements. There's also a new way that Medicaid is going to be counting income in order to determine who's eligible for coverage. So as has been the case in the past, Social Security benefit income does count. But supplemental security income for low-income individuals does not count when we're trying to figure out eligibility. And there's also no asset tax. And some of you may know that in Medicaid, and we'll talk about this a little bit later, in order to be found eligible for Medicaid based on having a disability, states typically use an asset test and look at your assets. And so for this new Medicaid eligibility group, there will be no looking at assets, which again should enable more people to be eligible. And again, as I just mentioned, the existing eligibility rules for individuals that have a disability determination that's made by the government, those rules all remain the same. Those haven't been changed at all. So as I mentioned, some states have decided to expand Medicaid. 25 states right now are expanding Medicaid as of January 1st, 2014. Some other states are considering expanding in the future. States can expand at any time. And so for now, 25 states are expanding. And I know sometimes this map is a little hard to read, so actually at the very end of the slide deck in the appendix, I have a list of all of the states that are expanding and the states that are not expanding, so you can clearly see whether your state is expanding Medicaid. So to be eligible for this new eligibility group that's established by the Affordable Care Act, individuals must meet some citizenship and immigration requirements, and then the following eligibility criteria that's listed here on the slide. And so individuals, to be in this group, you have to be age 19 to 64. Again, there are other Medicaid eligibility groups people can be eligible for based on disability or based on their age, and so those are separate from this group. So again, this is just to get into this specific Medicaid eligibility group. So again, you have to be 19 to 64 with income up to about $15,000 a year for an individual. You cannot be pregnant, and you cannot be entitled to or enrolled in Medicare Part A. And I meant to say this before, but I just want to flag that much of what I'm going to talk about today does not really apply to people who have Medicare. In this case, if you have Medicare Part A, then you cannot be in this new Medicaid eligibility group. And similarly for the marketplaces, they're actually discouraging people with Medicare from purchasing coverage in the marketplace and are suggesting that people with Medicare get Medicare supplementary coverage. And so I do want to flag that for if there's anyone on the call who does have Medicare. And then finally, to be in this new Medicaid group, you can't otherwise be eligible for another group. So all health plans in Medicaid and the marketplace, which we'll talk about later, must provide at least a core set of benefits, which are referred to as essential health benefits. And so there's minimum requirements. All plans must offer the benefits you see listed here: emergency services, hospitalization, mental health services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive care, and so on. However, there is some variation in the benefits that are going to be offered in different states, and some plans may offer additional coverage. Again, this is just a floor for what they're required to offer. And so when you're shopping for plans or after you're found eligible for plans, and we'll talk about this later, you'll want to look at what benefits are provided under this actual plan. I just want to flag two sets of benefits that I think are really important. One is prescription drugs. So all plans must include prescription drugs. And a little bit later, we'll talk about how to look at what the costs are for those prescription drugs and how you can compare plans to see what drugs and other benefits are covered. The other benefit I'd like to flag that I think is really important and has in the past tended to not be included in private plans is rehabilitative and habilitative services and devices. And so in general, habilitative services are designed to help individuals attain or keep skills and abilities. And in general, rehab services often consist of the same services, but they're aimed at helping people recover lost skills and abilities after an accident, an injury, or an illness. And so these are really important services that are now included. Again, states do have some discretion on how they define these services. So as we'll talk about later, when you are found eligible for these programs, you'll want to really make sure that any therapies and devices that you need are covered by this plan. So again, just to reiterate, these Medicaid benefits for this new adult group must provide at least these minimum essential health benefits. The benefits are going to vary a bit by state, and they're actually still being worked out a little bit. So unfortunately, I can't give super details on exactly what they'll look like in your state, but we definitely want to flag that they may vary, and so that's something you'll definitely want to look into. Another thing to note is that after individuals are found eligible for Medicaid for this new group, if the individual is considered medically frail, they may have a choice of the benefit plans, and again, states do have discretion on how to identify who is medically frail, but the definition has to at least include individuals with serious and complex medical conditions, individuals with a physical, intellectual, or developmental disability that significantly impairs their ability to perform one or more activities of daily living, or individuals with a disability determination based on Social Security criteria. And so, again, we'll talk about this later, but if your health condition meets this definition of medically frail, you might be eligible for some additional benefits. And so that's just an important thing to keep in mind after you're found eligible for coverage. As I mentioned before, the Medicaid rules for individuals who have a disability determination from the government do remain the same in terms of the eligibility levels and the asset tests and how they count income. So again, that is the same. Benefits for people who are found eligible for this new Medicaid group and who have income below 138% of the poverty level, the benefits might be different for this group than they are for people who are found eligible based on a disability determination. So if you do think you might be eligible for Medicaid based on a disability determination, but you haven't had the determination yet, you can receive this Medicaid coverage or marketplace coverage while you wait for that disability determination. And so that's really important to keep in mind. It does involve filling out a separate application, and there is a way to indicate on the single application that would be used to apply for Medicaid and marketplace coverage to indicate that you want to be considered for Medicaid based on having a disability. And so that's something important to flag because, again, the benefits may be different if you're in a different Medicaid eligibility group. So I'm just going to pause here to see if any questions have come in on what we've talked about so far.
So sorry, I started talking on mute. I'm sorry about that, everyone. I think we have one that asked if you could explain a little bit about why Medicare beneficiaries are being discouraged from purchasing additional coverage in the marketplace, and maybe you could clarify to folks what that means for them as a Medicare recipient.
Yeah, so it's a really good question, and actually we're in the middle. It's been a little bit controversial, and so we're in the middle of trying to flesh that out and look at some old regulations and figure that out, because I actually wasn't aware of this until recently, but the federal marketplace in their call center materials and in what they're telling consumers are encouraging people with Medicare not to apply through the marketplace because they already do have Medicare, and apparently there's some rules around that those individuals really should be purchasing a Medicare supplementary plan. And so again, it is a very, I'm with you, it's a very interesting thing, and so we actually are in the process of trying to figure out the details on it and get some more information from the federal government to see if this is in fact going to be the case. So I can certainly follow up with Elizabeth after this kind of gets worked through, but as you can see, there's still some issues that we're also figuring out.
That'd be great, thank you. Kind of complementary to that question, somebody asked, if you go into the marketplace now and you later become eligible for Medicare, maybe because your disability progresses, is there an option for you to stay in the marketplace rather than going to Medicare?
You know, that's a great question. So the thing is that, and we'll talk about this a little bit later, in the marketplaces, if you are eligible, if you want to get financial assistance to help pay for your premiums and cost sharing, you actually cannot be eligible for other coverage. So if you're eligible for Medicare coverage, you cannot get financial assistance in the marketplace. So that might be important to people who need that financial assistance. In terms of being able to pay full cost in the marketplace, I don't know if someone would rather do that. I would assume Medicare coverage would be much more affordable. And then again, the person could buy a supplementary plan to go with it. So it does get back to the initial question of whether people can buy people with Medicare can buy marketplace coverage at all. But in general, it sounds like that will probably not be the case at the moment.
Okay. Another question is, can the plans limit the number of physical therapy and occupational therapy visits?
Yeah, and that's something we'll talk about a little bit later. I'll actually show you a visual of a plan summary. So as I was saying, and we'll get into the marketplace stuff next, there are these essential benefits have to be covered, but there is some room within the benefits to define them differently and to put some limits on them. And so, again, we'll talk about this later, but that's why it's really important to go through. I know it's a pain. I can't stand doing it myself, but to go through the nitty-gritty details of the plan to really make sure it covers what you need.
Okay. And then the final one, and then we'll go on and save some of these for later, is really more of maybe a confirmation. But the question is, can you qualify for Medicaid if your adjusted gross income is below the cutoff but your assets are high?
So that's a great question. And so again, for this new Medicaid adult group, we do not look at assets at all. And so if your modified adjusted gross income is below the eligibility levels, and you meet the other criteria, you are eligible for Medicaid, which is, again, a big thing to not look at assets. It really helps a lot of people. And can I just jump in? I did see one question about is the new Medicaid adult group available in states that do not do expansion? I just want to make sure that this is clear. Unfortunately, the new Medicaid adult group is only available in states that decide to expand Medicaid. This is exactly what the decision is about, and we'll talk a little bit later about options that are available to people in states that do not expand Medicaid, but in states that do not expand, the coverage options are going to be more limited.
Great. I think the others we can probably hold off until you complete the rest of the information, Tanya.
Okay, great. Then let's continue. Looking at all these questions. Oh, there was questions. We haven't got that. Okay, great. So let's dive into these new marketplaces and talk about what they are. So at these new marketplaces, you can figure out if you're eligible for a qualified health plan that's offered through the marketplace. You can compare your plan options. You can pick a plan and enroll in it. And you can also see if you're eligible for Medicaid and CHIP. So again, we'll talk about this later, but you can submit one application, and behind the scenes, they'll figure out what program you're eligible for. So residents of all states have access to marketplaces, unlike what we just said about the Medicaid expansion, that only some states expanded Medicaid. People in all states can get coverage through the marketplaces. There are a few different models that are used, though. So there are some states that operate their own marketplace, like California and New York. Actually, it would have been helpful to have a list. Maybe I can send that back around later. And so in these states, you'll apply to that state-based marketplace for coverage. There are also marketplaces that are run by the federal government. We call that a federally facilitated marketplace. Those marketplaces, you apply for coverage at healthcare.gov, which I'm sure you've heard a lot about, and we'll talk a little bit later about it. And then there's some models where the state and the federal government are working together and kind of are doing different functions in order to run the marketplace. But to find any of these, and again, we'll talk about this later, you can go to healthcare.gov and it'll connect you to your state. So here actually is the map of state marketplace decisions. So you can see 16 states in DC have elected to run their own marketplace. 7 are working with the federal government, and 25 states are having the federally facilitated marketplace. and there may be some change as we move forward, where some states might move from the federally facilitated marketplace but to the state one. But for now, this is what the status is of the marketplace models. So there's just 3 main criteria for eligibility for the marketplaces generally. Again, this is not for financial assistance. This is just generally to be able to apply to get coverage through the marketplace. You must be a resident of the state where you're applying. You must be a U.S. citizen or lawfully present, and you must not be incarcerated. So as long as you meet these 3 criteria, you are eligible to get a qualified health plan in the marketplace. And we'll talk a little bit later about eligibility for financial assistance. So the marketplace offers 4 categories of qualified health plans, which are known as metal levels. And the metal levels are distinguished by the share of healthcare costs that the qualified health plan is expected to cover. The marketplace also offers some non-metal plans, such as catastrophic plans, but only certain people are eligible for those, and they don't provide nearly as much comprehensive coverage. So these plans you can see, like under bronze, it says 60% actuarial value. The actuarial value is the percentage that the insurance companies will pay on average for the healthcare services that consumers use. And so consumers, we still have to pay the balance through coinsurance, copays, and deductibles. So premiums are higher for plans that pay more out-of-pocket medical costs, like the Platinum plan and the Gold plan. Platinum plans have the highest premiums, but they have the lowest out-of-pocket costs. So this means that the plan will cover more of the costs when a consumer uses the services. The Bronze plans have the lowest premiums, but the highest out-of-pocket costs. So this means that the consumer will have to pay a higher share of costs when he or she uses services. And I do want to add, and we'll talk, well, I'll get to this a little bit later, but it is really important that we look at the premium costs, but that we also look at the out-of-pocket costs, so that when you go to the doctor or you get a prescription drug, we really want to make sure that consumers think about those costs as well as they're picking a plan. And again, we'll talk about that a little bit later. So once again, as we talked about earlier, all health plans must provide this list of minimum health care benefits. Similarly to in Medicaid, states do have a little bit of discretion on how some of these services are defined. So as one person asked, again, you do want to make sure that you look at the plan information for all the plans you're considering to make sure that they cover the specific services you need, with special attention given to the services, the limitations and the exceptions. So now we're going to talk about the financial assistance that's available to individuals to help them afford premium tax credits and cost sharing. And so I noted at the beginning of the webinar, Elizabeth said that in a survey they had done, about 55% of individuals have annual income of less than $35,000 a year, and about 16% have annual incomes of about $35,000 to $50,000 a year. And so it sounds like a lot of people, not necessarily in this call, but who took the survey, would be eligible for some sort of financial assistance, whether through Medicaid or through the marketplace. And so there are 2 types of financial assistance that's provided to individuals to purchase qualified health plans in the marketplace. The first is premium tax credits, and I'm sorry, I keep using federal poverty levels, which is too much lingo, so let me go back. So we talked about earlier. So basically individuals with income below $46,000 a year or families of 4 with income below $94,000 a year are eligible for a premium tax credit. If they don't have coverage, other health insurance coverage, as I mentioned before, that meets certain standards. And I do have some charts here that show that the federal poverty levels and the dollar amounts, so you can really see where you might fit in. The second type of financial assistance is for cost-sharing reductions, and this helps you reduce your out-of-pocket costs. So it's separate from your premiums, but it's designed to help reduce what you have to pay out of pocket when you go to the doctor. So just to dive in a little bit more to each of these, the premium tax credit is a new federal tax credit that's going to help subsidize the cost of purchasing qualified health plans through the marketplaces. It reduces the costs of a plan's premium. And so what happens is you pay your premium on a monthly basis, and then the federal government is also going to send a payment to directly to the health insurance company for the rest of your premium, basically. And so you don't, the tax credit doesn't come to you directly in the form of a check. It's directly sent from the federal government to the health insurance company, and then you pay the remainder of the premium. We'll talk about this a little bit later, but you can take the premium tax credit in advance, and when you take it in advance, it reduces your premium on a monthly basis. So if your premium in total is $500 and you have a tax credit for $300, you would pay $200 a month, and the health insurance, the federal government would pay $300 a month. So you can take it all in advance. You can take some of it in advance. So again, if your plan is $500 and you have a premium tax credit of $300, you could choose to take a little bit less. You could take $200 in advance, and then the federal government would pay the $300 a month. And we'll get to this later, but at the end of the year, the premium tax credit will be reconciled. And I know that sounds a little confusing right now, but we will talk about that. And so okay, so we'll get to that. And so you do have some choices about how much of the premium tax credit you take. You'll be told what your maximum amount is, and you can decide whether to take the maximum amount in advance, some of it, or you can wait till the end of the year and do it at tax filing time, in which case you would get all the money back at the end of the year, but it wouldn't help you towards the premium cost on a monthly basis during the year. So the premium tax credit can be used to purchase any metal plan we talked about, gold, bronze, silver, platinum. You can use it towards any plan that you pick. And yeah, so let's now move on to eligibility. So who can get a premium tax credit? So in order to be eligible for a premium tax credit, you have to be able to enroll in a qualified health plan, so you have to be able to meet those 3 requirements we talked about earlier of being a resident of the state, being a U.S. citizen or lawfully present, and not being incarcerated. You must have projected annual income between 100% of the poverty level and 400% of the poverty level. So when you apply at the beginning of the year, you fill out the application questions, and they actually ask you what you expect your income is going to be for the entire year. And if you think it's going to be in this range, then you're eligible for a premium tax credit. I do want to flag here that, as I talked about before, in states that expand Medicaid, the eligibility level for Medicaid goes up to 138% of the poverty level. So that means that in states that expand Medicaid, individuals up to 138% of the poverty level will be in Medicaid, and then individuals 139% of the poverty level to 400% of the poverty level will be eligible for premium tax credits in the exchange. In states that do not expand Medicaid, individuals in those states are eligible for the premium tax credit starting at 100% of the poverty level, so it's a little bit lower. And so individuals in states that do not expand Medicaid can get the premium tax credits if their income is expected to be between 100% of poverty and 400% of poverty. Another important thing about eligibility for the premium tax credit is that you have to lack access to other coverage that meets some minimum standards. And so this came up earlier in terms of Medicare. So if you have affordable coverage through your employer, if you have Medicaid, if you have Medicare, you're not eligible to get a premium tax credit, which makes sense because you're getting some federal financing for that other coverage. And then finally, you have to meet some tax-based requirements. So you have to plan to file a federal tax return at the end of the year. The premium tax credit is a federal tax credit, and so you do have to, again, you're applying at the beginning of the year, but you have to plan to file a federal tax return at the end of the year. If you're married, you have to plan to file a joint tax return with your spouse, and you can't be eligible to be claimed as a tax dependent by anybody else. So there are some just basic tax rules that are important. So families are expected to contribute between 2% and 9.5% of their income towards QHP premiums. The percentage they're expected to contribute is based on a sliding scale depending on their income. So to figure out your contribution amount, the marketplace will use the information you provide to figure out, first of all, who's in your family, how many people are in your family, how much income does your family have, and then they'll compare your income to the federal poverty level. And so if you look at this slide here, I've highlighted 2 items in orange. So if we look at a family of 4, that is at 150 to 200% of the poverty line, which is about $35,325 to $47,100. Someone at that income level is expected to contribute between 4 and 6.3% of their income. So if you're on that lower end and you make $35,325 a year, the maximum premium you'll have to pay per month is $118. Similarly, if you make $47,100 a year, the maximum monthly premium you'll have to make is $247 a month. And again, the federal government makes up the remainder of whatever the premium cost is. Similarly, for an individual at the same level, you can see if you make $17,235 a year, your maximum premium is going to be $57 a month. And if you make $22,980 a year, your maximum premium is going to be $121 a month. And so this is a very important chart. If you can figure out where your income is on here, it'll help you figure out what your maximum premium cost will be per month. So the second type of financial assistance are cost-sharing reductions. And these cost-sharing reductions basically help subsidize any out-of-pocket costs you have for doctor's visits or other co-payments. And so again, the federal government makes payments directly to the health insurance issuers to reduce the deductibles and the co-insurance and the co-payments for the out-of-pocket costs. And so this provides extra help to people to be able to afford their out-of-pocket costs. And as is noted here, the amount you get depends on your income on a sliding scale. And when you apply, you're automatically assessed for these cost-sharing reductions unless you decide to opt out and do not want any financial assistance. So who's eligible for these cost-sharing reductions? You must meet the eligibility requirements for a premium tax credit that we talked about. So you have to have again, be a resident of the state, be a U.S. citizen or lawfully present, not be incarcerated, and then you can't have access to other minimum essential coverage, and you have to plan to file taxes and all those things that we talked about. For cost-sharing reductions, they're available to people who have expected annual income below 250% of the poverty level for the coverage year. And I apologize, I don't have the dollar amount right here, but we can see it in the slide pretty soon. So while premium tax credits are available for people between 100 and 400% of the poverty level, cost-sharing reductions are only for people below 250% of the poverty level. And one thing that's really important, and I'll remind you about this later, but if you are eligible for cost-sharing reductions, you can only get them if you select a silver level plan. So if you select a gold plan or a bronze plan, you cannot get those cost-sharing reductions. So that's really important. So I'm going to pause here again. I see a bunch of questions have come in. So can we turn to a couple of those?
Absolutely.
Great.
So one question is, RE, the premium tax credit. Can you get the credit if you file taxes, but you aren't required to file? In other words, you had no tax liability, but you did go ahead and file.
Yep, absolutely. And I think that's something that's very common, but there are people that don't meet the tax filing threshold who are not required to file taxes. And so can you get the credit? I mean, I think I want to take this back, but pretty sure if you're not required to file, then you're likely eligible for Medicaid. However, if you live in a state where Medicaid didn't expand, there might be a separate issue. So why don't I take that question back, because it is a really good one, especially in states that don't expand.
Okay. Our next question is, who decides whether Medicaid will be expanded within a state? And a follow-up question to that someone else asked is, is there a period of time in which a state decides? In other words, if a new governor comes in, is that a new opportunity for the state to decide to participate?
Yeah, that's a really good question. So it's the governor of a state and the state legislature that typically decide whether Medicaid is going to be expanded or not. And yes, states have the choice to expand Medicaid at any point. So they can expand it for January 1st, 2014. They can decide in 2 months or 6 months or a year that they want to expand Medicaid. So there's no limit on that. So there could be states that still do decide to expand, and that would definitely be something in a state. If you live in a state where Medicaid has not expanded yet, you definitely want to be on the lookout for that in case that option opens up.
Another question is it a good assumption to assume that the federal facilitated marketplace is the preferred program versus the state?
Nope, not at all. They're just operated differently. The state-based marketplaces actually have been really successful overall in enrolling eligible people. You've probably heard about some of the stuff that's been going on with healthcare.gov. Many of the states have not been experiencing those same problems. So no, it's just operated differently, but all of the rules are the same. So when you put in your information, you should get the same eligibility determination regardless of whether you apply at a state marketplace or at the federal marketplace. There's no difference at all.
Tanya, as you're probably well aware, when individuals are applying for disability, the disability determination process can be quite long.
Mm-hmm.
So if you are participating in the marketplace and you later find that your disability determination has made you eligible for Medicaid or Medicare, what happens then?
Yes, I'm so glad that somebody asked that. Because I do think that this Medicaid option and the marketplace option are especially helpful for people who are waiting for that disability determination that can take a really long time. And so if you do get that disability determination, the Medicaid office will notify you, they'll notify the marketplace, and so you'll be transitioned into Medicaid, right, if you do meet those requirements based on a disability. And so the plan in the marketplace will be canceled, and you'll get that Medicaid coverage. And the transition of how that all works should flow very seamlessly. Okay,
great. We also have a few very specific questions that we'll try to I'm going to try my best. So for those who ask these questions, if I get any piece of it wrong, just please feel free to email me. My email is going to be at the end. This is Elizabeth, and we'll get those questions more specifically to Tanya, and we'll get you a personal response later. But
and I apologize in advance if I can't answer specific ones. I know there's so many nuances out there, so I want to make sure I get it right. I don't want to give you inaccurate information. So if I'm not 100% sure, I'll take it back and get back to you.
So the question really relates to individuals that are in same-sex relationships.
Mm-hmm.
And what happens if their state does not recognize their relationship and their state has rejected the expansion of Medicaid? What are going to be their options within a state of that type?
Yep, so that's a good question. So I would say, so unfortunately in Medicaid, if you live in a state that doesn't expand, unfortunately your coverage options are limited. But same-sex couples can get coverage through the marketplace. And I want to go back and look at the rules a little more carefully because I haven't been in them as much recently. But it's my understanding that if you are in a same-sex marriage, that in order to get a premium tax credit, you are required to file taxes jointly. So that's just something to note. As I mentioned before, married individuals must plan to file taxes together to get a premium tax credit, and that includes same-sex marriages.
Great. And the individual who asked that question, I'd really encourage you to email me directly, because I think your questions had a lot of nuances in it, and we can get that over to Tanya for a more detailed
Yeah, I would love
response.
to do that, actually. I'd like to look back at the rules a little more carefully, because I was immersed in them a while ago, but not recently, so I want to make sure I get that right. So please, yeah, let's definitely do that.
We have another great question about intergenerational households. So an individual who has their aging parent with them, as well as their daughter who's a recent college graduate. How does the marketplace view them? Is the individual in the sandwich generation, do they count the others living that they're supporting in their household as dependents, or does each count as an individual single adult?
Yep, so that's a great question. So, of course, it depends on the situation. So if we'll say the aging parent, the adult, and the daughter are kind of the three levels of language I'll use. So if the adult claims their parent and their daughter as a tax dependent, if they plan to claim them at the end of the year on their taxes, then they are considered part of that person's household. And so in that situation, the household size would be 3, and the income of all of those 3 individuals would be included. The recent grad she probably would be, it depends on her age. Well, she probably would be. So you would include the income of all those people, and it would be a household size of 3. However, the rules for Medicaid are a little bit different. And so in Medicaid, they would look at that household of 3, but then they would actually make some adjustments. And so if your income is below those Medicaid levels, if it doesn't look like you're eligible for, actually, they'll look at your Medicaid eligibility first, and so they'll break down that household. And so what would happen is for the daughter, who's the recent grad, the aging parents, so aging grandparents' income would not count in determining her eligibility. So I hope that's clear. So again, these are Medicaid-specific rules. The marketplace rules are just based on who files taxes together. So again, if the aging parent files taxes on her own, then her household is just her and just her income counts. If the adult files taxes and claims these other 2, then they're all considered part of her household. But again, for Medicaid purposes, we do not count the grandparent's income when we look at whether the daughter is eligible for Medicaid. So I think that lays it out. I can certainly write it out too later, but these household rules are complicated. But I think I got to the question.
Great, thanks, Tanya. And for those of you on the line, again, we're going to provide you with my email address at the end. So if you're looking for an answer to a question that has these kind of nuances, please do feel free to email them in. We have another question which asks, how does being eligible for COBRA impact your eligibility for the marketplace?
Yeah, so that's a great question, and that's one I also want to take back a little bit, but my inclination is, I know COBRA is so expensive. Every time I'm offered it, I just cannot believe how much it costs, and so the marketplace is a really good option, alternative option for people who do not want to purchase COBRA. They can purchase coverage in the marketplace. And so I can go back and get some nuances on that, but for sure, anyone who's been offered COBRA or has COBRA should look into the marketplace options.
Great. Shall we take 2 more, Tanya, and then we'll let you get on with the
Yep, we can get to that last section.
Okay. So one is, this is another pretty detailed one. It's an individual who is on Social Security and has just started receiving their Medicare. They're wondering when their daughter, who's a full-time college student, when they look at coverage for her, will the income requirements take into account the Medicare premium that's paid?
The Medicare premium that's paid.
So your cost for insuring other members of the family, is that taken into account when they look at your income?
At your income, yeah. I don't think so. I don't think so. And actually, that required contribution slide I showed, oh, here we go. Going back to it here, this also does not take into account whether you have additional costs for someone else who might be buying other insurance, whether it's employer-based coverage or premium. So when we look at this maximum premium amount, it does not account for the fact that you might be paying premiums for other people in the family.
Okay, thank you. And then we had a follow-up question which asked if I'm operating in the marketplace, if I'm receiving healthcare through the marketplace, and then I do become eligible through the disability determination, are my premiums refunded to me? So will they give you,
right,
sometimes
so I don't,
you do get some back pay.
So no, I don't think they will be refunded. You know, we do know with Medicaid can provide some help to people who have medical bills, but you're not considered eligible for Medicaid until you get that determination. And so while you're considered eligible for this marketplace coverage and you're paying those premiums, unfortunately, you can't get those premiums back.
Great, thanks, Tanya. I think any other ones that we find we missed, we'll ask you in the next question
Okay, great.
period.
So let's just move on to this last section. Just a little bit. So now we'll get to the practical stuff because we've been talking about the rules, and I know it's a lot, but it sounds like people have been able to follow because we're getting such good questions. So I really appreciate that. So let's talk about practical stuff. So when do you have to apply for coverage? So in the marketplaces, the open enrollment period is going on right now. It started on October 1st, and it goes until March 31st, 2014. So you have to apply before March 31st, 2014. I want to add, and many of you may know that in Medicaid and CHIP, you can actually apply throughout the year. So you could apply in June and be found eligible for Medicaid. However, because you can only apply for marketplace coverage before the end of March, I strongly encourage people to apply for coverage before this date, because if it turns out you're not eligible, if you apply later on and you think you're eligible for Medicaid but you're not, you cannot go into the marketplace coverage in the middle of the year unless you meet some special conditions. So again, I would really encourage people who do need coverage or who are thinking about switching coverage to apply before March 31st, 2014. So after this year, the annual open enrollment period is going to be from October 15th to December 7th. So again, the enrollment period this year is a little bit longer because it's just getting up and running, but in future years, open enrollment will be between October 15th and December 7th, which I think is pretty similar to how employers do it. If you want, so when you select your plan will impact when your coverage starts. So in order for your coverage to start on January 1st, 2014, you must select a plan by December 15th, 2013. And you actually, there are different rules around when you must pay that first month's premium, but if you're applying for coverage through the federally facilitated marketplace, which again, many people will be doing, you have to pay your premium by December 31st, 2013. In order for coverage to start January 1st, 2014. There are some different rules in states on when you have to pay, but in general, probably by mid-December is a good idea to give a little bit of time to make sure that coverage starts. And then again, if you pick your plan between the 1st and the 15th of a month, between January 1st and March 15th, 2014, your coverage will start the first day of the following month. But if you pick your plan in the second half of a month, you won't get your coverage until the month after that. So if you pick it, let's say, February 17th, your coverage isn't going to start till April 1st, if that makes sense, because of the processing time. So that's just something to keep in mind. And then in future years, everyone will be enrolling during the open enrollment period, and coverage will be effective January 1st. So again, there will be consistency in future years. So there are some individuals who may enroll in a qualified health plan in the marketplace outside of this open enrollment period if they meet certain conditions for a special enrollment period, which I'm not going to get into right now, but if you experience a change, you have a new dependent, you have a child, you might lose a dependent, say your college kid goes off and they're going to file taxes on their own. So there are some situations, or they move, so they need a plan somewhere else. There are some situations where you can qualify for a special enrollment period. Okay, so where should you apply for coverage? People can apply online, in person, by mail, and over the phone. As you know, we'll talk about some websites later, but we'll get to this in a second. So as I mentioned before, there's a single application that you can use to apply for all of the programs. So Medicaid, CHIP, the qualified health plans, the premium tax credits, and the cost sharing reductions. So you're just going to submit one application. And then behind the scenes, they're going to figure out what program you're eligible for. So when you apply, you do not need to know which program you're eligible for. It will let you know once you input all of that information. And so in the application, you'll be asked about your household, about your income, and then the computer will figure out which program you're eligible for. So if you think your annual income is going to be below the Medicaid limits in your state, so again, in a state that expands Medicaid, below about $15,500 for an individual, or you think you might be eligible based on having a disability, I would recommend that you apply directly to the Medicaid office, just because it'll streamline the application process. And I've included a link here that's actually on healthcare.gov, but where you can search for your state and get the Medicaid office information. You can also easily just Google Medicaid and your state name, and it'll probably pop up. So again, if you think you're likely eligible for Medicaid, I would recommend applying directly there. But you can also apply at the marketplace. So healthcare.gov, I have that link here. And again, if you go to healthcare.gov and it turns out that your state is operating its own marketplace, it will give you a link to that state. So going to healthcare.gov is a good place to start. And then once you put your state name in, it'll direct you to your state marketplace if needed. But again, wherever you apply, whether it's at the Medicaid office or at the marketplace office, the same calculation will be done. It'll take all of your information and it'll figure out what program you're eligible for. And if you apply at the marketplace but you end up being eligible for Medicaid, it'll transfer that information to the Medicaid office. So again, you can apply anywhere, and you can apply using all these means. So as I know you've heard in the news, because it's hard to escape it, there have been some issues with healthcare.gov and with some of the other websites. And so I just want to flag here some things that I would suggest doing if you're not able to sign up online. So the first is to try again during off hours. Sometimes there's just so much traffic during the day that it's really hard to get on. It's a little bit easier to get on at night, so that's one thing I would try. You can call the call center. So for healthcare.gov, for states that are doing the federally facilitated marketplace, I've included the number here that you can call and talk to a live person. And they can actually walk you through the entire application over the phone. So I would definitely recommend that. There are also state marketplace numbers that you can find through healthcare.gov, and you can even call the federal marketplace, and they should be able to give you the phone number for the states. You can also call a local organization or a navigator in your state, which we'll talk about in a minute. And again, this link on healthcare.gov, you can search by your state and figure out some local organizations that might be able to help you apply. Another strategy is to wait a couple of weeks. I know people want to get coverage as soon as possible, but if you pick your plan by mid-December, coverage can start January 1st, which is the earliest coverage can start anyway. So you could wait a few weeks and kind of gather all the information you need that will inform selecting a plan, so your doctor's names, your prescription drugs, just kind of getting everything together. You can browse plans before you even apply for coverage, and so I've included a couple websites here, and state-based marketplaces, some of them let you do that too, so you can start looking around at plans and looking at your options. And I know I've been doing this with a lot of family members, just trying to see what's out there and just start thinking about it, because I find that it's hard to sit down and just choose your health insurance plan that minute. It takes some thinking and real research to make sure that the plan covers everything that you need. So as I mentioned, there are a lot of entities in the neighborhood that can help you apply. There's the state Medicaid agency, there's what we call certified application counselors, which are organizations and hospitals and clinics in the communities that can help you apply, and there are a few other entities that can help. Many of these assisters are likely not going to be well trained in working with individuals with disabilities. There are some initiatives out there, like through the Aging and Disability Resource Centers, that are working hard to provide good information to individuals with disabilities. But if you think you may be eligible for Medicaid based on having a disability, I would recommend that you contact the state Medicaid agency directly, because again, you'll have to fill out a separate application, and you might fill out this other application to get coverage immediately, but it would be best to go straight to the Medicaid agency. And again, at the top of this, you see the link of entities where you can search by your state and find entities that can help you. So once you submit the application, as I mentioned, the system, the computer is going to figure out what coverage program you're eligible for. So it'll tell you if you're eligible for Medicaid or CHIP. It'll tell you if you're eligible for marketplace coverage, premium tax credits, and cost-sharing reductions. And so the computer looks at your income, and it looks at the number of people in your household, and then it compares it to the federal poverty level, which is basically this chart here. So I've been using these dollar amounts and these FPL amounts, so hopefully this is a good, more helpful reference, since I know the FPL level language is a little too lingo-y, but you can see here I've highlighted two orange things. For a household size of 1 at 133% of the poverty level, which 133 and 138, I realize I've used both here. It's 138% in total, but they're basically the same thing. So if you are a household of 1 and you have annual income of about $15,282 a year, then you're probably eligible for Medicaid, and the system will let you know that. If you're in a family of 3 and you have income below $78,000, again, this is what you're expecting to make for the whole year, for your entire family, below $78,000, you'll be eligible for a premium tax credit. And so you can look at your household size on the left and your dollar amount, and it'll tell you what your federal poverty level is. So what do you do if you're found eligible for Medicaid? You put in your information and the system pops out that you're eligible for Medicaid for this new adult group. The first thing you want to do is ask what benefits are covered. As I mentioned before, all plans have to cover at least some minimum essential health benefits, but there will be some variations in states and there will be some limitations and exceptions, and so you really want to make sure that the benefits and services and devices that you need are going to be covered. Secondly, you'll want to ask if you might be eligible for a different eligibility group and or additional benefits based on your health condition, as we talked about before. So again, just making sure that you get to the right place within the Medicaid program to get the services that you need. And again, you may start in one part of the Medicaid world and then get your disability determination and move eligibility groups, and then you can get some different benefits. But I just want to flag that it's really important to ask these questions when you have a health condition that you think might qualify you for some more benefits. So what do you do if you're found eligible for marketplace coverage? So the first thing I just want to remind everyone is that if you're eligible for cost-sharing reductions, so if you have income up to 250% of the poverty level, you'll likely want to select a silver level plan because you can only get these cost-sharing reductions if you enroll in a silver level plan. So just please keep that in mind. It's really important. And then there's just some key questions that I would ask while I'm looking at these plans, and I go through this with my family all the time because there is a lot of information in the plans, but here are some things that are just good to keep in mind as you're thinking about the priorities for the plan. So first, what is the monthly premium, which, as I'm sure you know, is the amount you pay each month for coverage? What's the annual deductible? This is the amount you owe for healthcare services that your health insurance or plan covers before your health insurance or plan begins to pay. So for example, if your deductible is $1,000, your plan won't pay anything until you've met that $1,000 deductible for covered services. And it's important to note that the deductible may not apply to all services. So for preventive care and some other services that would be laid out in the plan summary, the deductible might not apply. Third, is there a separate deductible for certain services? Some services do have a separate deductible in addition to the annual deductible, for example, prescription drugs. Can you still hear me over there? I see someone just lost audio.
Yes, we can still hear you.
Great. Just making sure. Then what is the next question is, what is the out-of-pocket limit on healthcare expenses? So these are your expenses for medical care that aren't reimbursed by insurance. So they include deductibles, co-insurance, and co-payments for covered services. But the plans do have limits on what you'll be required to pay out of pocket, so definitely take a careful look at those. You want to ask, what's the co-payment for office visits and specialist visits? Co-payments are usually a fixed amount that you'll pay for a covered service, usually when you get the service, when you go to the doctor. You'll want to ask, how much will my prescription drugs cost? We'll see in a minute. I'll show you an example of some plan information and how that's organized to look at your generic drugs and your preferred drugs. We'll want to ask what benefits are covered by the plan, especially the habilitative and rehabilitative benefits. As I mentioned before, there can be some limitations, so we want to make sure we take a careful look at exactly what benefits and therapies are covered and if there are any exceptions or limitations. And then finally, we want to see whether the plan covers your healthcare providers, right? Many of us like to stick with the same providers, and so in many cases there'll be a link in the plan summary so you can see the entire directory of providers they cover, because that is very important to many of us. So here's just an example. All of the marketplace plans are required to provide a plan summary. And there is more information also, but at a minimum, this is kind of the first thing you might see. And so if you see on the left, we have common medical event. So this is related to prescription drugs, and you can see it breaks out generic drugs, preferred drugs, non-preferred brand drugs, and specialty drugs, and what the cost would be to you if you do get one of these drugs from a participating provider. You'll see there's a column of what the cost is if you use a non-participating provider, and so definitely keep a lookout for that. Some plans will not cover providers that are outside of the network, which I'm sure you're familiar with, and so it's really important to look at that, and especially if you think you'll be using some out-of-network providers. And then, as I mentioned, there are some limitations and exceptions that you can see on the left, and so you'll just want to make sure that you look closely at those. And then here's another example. This one looks at habilitative and rehabilitative services. So you can see the services listed: home health care, rehabilitation services, habilitation, skilled nursing care, durable medical equipment, and hospice care. And again, the cost to you as well as limitations and exceptions. So this just gives you kind of a high-level idea of what you might see. So what do you do if you're found eligible for a premium tax credit? So after the marketplace determines your eligibility for the tax credit, you'll basically be giving a total amount that you can receive. And so you can shop around for different plans and see how much you would have to pay, taking into account what your premium tax credit is. And so if you buy a relatively expensive plan, you'll have to contribute more of your own money towards the premium, right? The premium tax credit won't cover it all. If you buy a cheaper plan, you'll have more of the cost covered by the premium tax credit. And so you'll want to look at the plans, but look at them with your premium tax credit, because it will let you know how much you are going to have to pay. And in most of the websites, it'll show you your premium tax credit, and it'll let you decide how much of it you want to take, some of it, all of it, none of it, in advance, and then you can look at the plans, and the planned costs should take into account that premium tax credit, so you can really see what you, in the end, will have to pay per month. So as you do shop, though, you just want to keep in mind both the premium costs and the out-of-pocket costs, because when we do use services, that costs money, and so we want to make sure that those out-of-pocket costs are reasonable. So again, you can take the premium tax credit in 3 ways. You can take it in advance, and when you do that, you get help on a monthly basis in terms of to afford your premiums. You can take it at the end of the year when you file taxes, and if you do that, you'll get a tax refund, but you won't be able to put the premium cost, your premium costs won't be reduced month to month. Or you can take a combination approach and take some of the premium tax credit in advance and some at tax filing time. And then I mentioned at the end of the year, the premium tax credit you received in advance will be reconciled based on what your actual income is on your taxes. So as I mentioned, when you're applying at the beginning of the year, you don't know exactly what your income is going to be for the year, but you estimate it in order to figure out what program you're eligible for. But at the end of the year, when you file your taxes, the federal government knows this is actually what you made this year. And so they'll go back and look at your premium tax credit you took and reconcile that and figure out whether you should get more of a tax refund or whether you'll have to pay additional money. So if your income ends up being higher at the end of the year than you thought, you'll have to pay some money back. And so that's why I think this third combination approach is so important. If you can afford your monthly premium costs without taking the full amount of the tax credit, I would recommend doing it just because it gives you a little cushion in case your income at the end of the year does end up being a little bit more than you expected. And then just some things to keep in mind during the year. If you experience a change, you really do want to report that as quickly as possible because it does impact your eligibility and also your eligibility as well as how much of a premium tax credit you get. So examples of changes that should be reported include a job change, if your income goes up, either because you get a new job or you get overtime or some tips. If your income decreases, if you get married, if you get divorced, if you have a baby, if someone in your house has a baby, if your college student moves out of the house and they're no longer a tax dependent, and if you get coverage, if you end up gaining other minimum essential coverage like employer coverage, you're going to want to report all of that. And so I think that brings us to the end. So we have a few more minutes left to do a couple questions. And I'll just note there are a couple slides in the appendix, a list of the states that are expanding Medicaid and not expanding Medicaid, another federal poverty level chart that shows you the levels by monthly income rather than annual income, and then just a general step-by-step process for applying for a qualified health plan and financial assistance. So shall we turn to some final questions?
Great. Thank you so much, Tanya. And thank you for your presentation. That was excellent and very informative. We do have quite a few more questions. So one of the questions is, if you do enroll by March 31st and you decide in June that you don't like your plan, when's your option to change?
Yes, your option to change is not until the next open enrollment period in the fall, unless you experience something that enables you to apply during a special enrollment period.
Okay. Another question was, what does it mean to enroll? Do you have to meet your enrollment requirement, do you have to pay for your premium or do you have to select an option plan?
Yes, so you have to select a plan. So as we talked about, in order for coverage to be effective January 1st, 2014, we'll just use that as our example, you have to select a plan by December 15th, but then you also have to pay the first month's premium. And as I mentioned, in the federal marketplace, you have to pay it by December 31st, 2013. It might be a little bit different in states. It kind of depends on the state, but you do have to pay your premium for the first month in order for coverage, in order to technically be enrolled and to have coverage.
And for those who don't choose and pay for a plan immediately, at what point is there a penalty?
Yep, so that's a good question. So if you do not have health insurance for less than 3 months, you will not be assessed a penalty. But after that point, if you go 4 months without health insurance, you'll have to pay for those first 4 months. You'll pay a penalty for that entire time. So you can go less than 3 months without getting any penalty at all. But after that, you will be assessed a penalty at the end of the year.
Another question is, if you don't opt for the advance credit and you get the credit after filing your taxes, does it go to the insured or to the insurer who then refunds the insured?
So if you decide not to take the premium tax credit in advance, but you decide to take it, so that means that every month you're paying the full amount of the premium. So if your premium is $500 a month total, you're paying the entire $500 a month. But then at the end of the year, once they reconcile the premium tax credit, they figure out that you actually should have gotten a premium tax credit of $100 a month. So they're going to take that $100 a month, multiply by 12, and they're going to give you a tax refund of $1,200. So you're getting the same amount of premium tax credit, whether you get it early or later, but it reduces the chance you're going to have to pay anything back. So again, that's why we recommend taking a little bit less than the maximum you're eligible for.
Okay. There's a question as to whether or not men and women of non-childbearing years have to have maternity coverage, and if they do, why is that?
You know, that's a good question. It's probably not something I can get into just because, I'm just here to explain the minimum requirements. But, yeah, so I can't really answer that. I'm just kind of reporting on what the rules are.
No problem. Let's try for 2 more fast ones, and then we'll say our thank yous and let everyone go. How secure do you feel the healthcare.gov website is at this point?
That's a good question. I think the reports are that it's getting better and better. I know they have a huge technical team working on the issues. Heard on the news this morning that people are able to get on a lot better than they were before, and so I definitely think it's improving.
Okay, and the last question is actually one for me. It's, will the slides be available as well as the summary? And yes, they will be available. We'd also like to, Nikki, if you could give me the ball, we'd also like to show you the final resources that are available to you. But we'll make all of this available to you on our website over the next 3 days. You don't have to do anything. We'll send you an email letting you know that the webinar has been archived and that the materials are available for you to review. They'll also be available with a transcript. Again, if you have additional questions that weren't answered today or new questions pop up, please feel free to email me. I'm Elizabeth Jennings, and my email address is available to you here. You can also email Keith Combs. Either one of us will be available to you. We'd be happy to share your questions with Tanya and get you the answers that you need. I just want to give a special thank you to Tanya Schwartz for being our presenter today. Your comprehension of this subject is amazing, and we're so grateful to you to take the time with us today.
Thank you, and thank you all for your really good questions. I appreciated them, and I look forward to circling back on a couple. I've written them down, and so I'll definitely circle back to make sure we can get you some answers.
Thank you so much, and another thank you to our sponsors, Accorda Therapeutics, and to all of you for joining us today. Again, I know we didn't get to every question, but please send them to me, Elizabeth Jennings, at EJENNINGS@NDI-INC.org. If you missed anything, you can always go to our website, realeconomicimpact.org, and there's an option to ask us questions from our main page, and we'll be happy to help you find anything that you need. So again, thank you again to Tanya Schwartz, thank you to Accorda Therapeutics, and thank you to all of you for joining us today. I hope you have a great rest of your day.